So positioning is very important for bag valve mask ventilation, not just for intubation. So get your kids in the sniffing position early, because remember, the BVM is your rescue device. It's very rare that a child is difficult to bag. There are some populations of children that are difficult to intubate, and you may not be able to intubate all children, but you don't need to be able to intubate them. You need to be able to ventilate them and oxygenate them. So remember, the positioning is very important for BVM. So some pitfalls, some problems that people often do is they're pressing down on the mask trying to get a good seal. Again, it's easy to tunnel vision in here where you're pushing down, but actually that pressure, when you drop that chin down towards the chest, you're causing an airway obstruction. So flexing the neck forward actually not only obstructs the upper airway, but you can actually bend that flexible trachea and obstruct the airway there. So you can see in the left upper corner where that red arrow is, you have these rolls of chin fat. This person is just smashing that face down and obstructing that airway. So they're not going to be able to ventilate this kid. So the lower picture here, you can see the fingers are going under the jaw, pulling the jaw up into the mask, and you have this nice open anterior neck space. So the other problem, the other pitfall of pediatric ventilation is excessive rate. So we're really excited. Again, there's a high cognitive load on these pediatric patients. So it's really easy to hyperventilate them. Yes, they need a rate that's faster than adults, but if you hyperventilate them, then you're overinflating the lungs and you're not giving them time to exhale. So regardless of the rate, always think of your cadence as squeeze, release, release, squeeze, release, release. So watch for that gentle rise and fall of the chest and allow plenty of time for exhalation. Here's a nice picture from your book that shows as you press that mask down, flexing the neck forward, that you cause an airway obstruction, versus if you're pulling the chin up with a nice jaw thruster maneuver, you're pulling the chin up into the mask opposed to shoving the mask down, then you have a nice open airway. So here's kind of a 3-step process to think about. So position them optimally to start with, get that nice sniffing position. And as you're getting ready to bag them, you're going to give this neck extension. You're going to extend the neck just a little bit, make sure you have a nice open anterior neck space. And you're going to give a jaw thrust. So the jaw is coming up and forward. And then you're using a two-handed technique. So maybe you're not doing this on every patient, but definitely if you're not getting very easy, smooth ventilations with a one-handed technique, your very next move should be, after you position, is to go to a two-handed technique. So fingers under the jaw, lifting the jaw up into the mask as you're doing the thenar grip, pushing down into the mask.